Thank you, Mr. Chairman, and thank you, Secretary Azar, for testifying today. I'm from Brookhaven, a small town in southwest Mississippi, and so I'm well aware of the challenges that rural state presents in health care. But I was pleased to learn that the CMS recently released the agency's very first Rural Health Strategy intended to improve the quality of life for Medicare benefits who live in rural areas. So I thank you for working to ensure that the voices of rural patients and healthcare providers are heard, and when your department considers payment policies and regulations, that consideration. Secretary Azar, can you discuss further how your fiscal year 2019 budget request will support health in rural America?
Thank you very much, Senator, and it was a pleasure to meet you over the phone. Thank you for that. First, the budget has $5.1 billion for community health centers, and the community health centers serve 1 in 12 Americans around the country, but in particular 86 million patients, 1 in 6 living in rural areas. So our bipartisan support for the community health center program is, of course, vital to health care in the rural communities. We also, with the opioid epidemic, we've added something very novel in here, which is a $150 million program for opioid treatment focused in rural areas. And then, of course, we have the program that you mentioned that we've just laid out, the CMS Rural Health Agenda. And we have programs there, for instance, that would allow Medicare Advantage programs to deliver telehealth services and other services in a rural area more economically. I also want to look if you or others can identify where we have barriers in our payment regimes or regulations that impede alternative or innovative methods of care delivery in a rural setting. You know, we know the issue in Mississippi of rural hospitals suffering and closing. Maybe traditional hospital models aren't the best way to deliver care economically feasible. Are we getting in the way of the creativity of new models for delivering the kind of care that's needed in those communities?
Thank you. Also, rural America has 20% of the population and 9% of physicians. And when I was in the Mississippi legislature, we worked to establish the Mississippi Rural Physician Scholarship Programs to help address the shortage of physicians in the rural areas in the state. And it was a great benefit. We're still reaping those benefits today. But how does your budget request support physician workforce in rural places like Mississippi?
So what we've tried to do is prioritize the programs that we believe work the best, especially in getting providers to go to underserved areas. And those are the scholarship and tuition reimbursement programs. As you look at, say, the HRSA budget, our focus there is direct service care delivery and then workforce training that is based on scholarship and tuition reimbursement. We just find that those programs deliver health professionals, and they also have service obligations connected to them that help us get people into remote areas, underserved areas, to be able to deliver, as opposed to the programs that we have that are, for instance, just more subsidy payments to institutions. The individual targeted ones, we think there's decades of evidence that show that those really do work and deliver, and we want to focus in that space.
Great. Thank you.